Osteochondral lesions of the knee. Patient perspective for physical therapy.
What are osteochondral lesions?
This is a picture of a healthy knee joint. The bones in your joints are covered by cartilage. The purpose of this cartilage is to protect your bones and make it easier for the bones to move over and glide over each other. These are pictures of not so healthy joints. An osteochondral lesion occurs where that protective cartilage becomes separated from the bone. This can cause pain in the joint and get in the way of normal joint motion.
What can I do to prevent an osteochondral lesion?
Staying active is actually the best way to keep your joints healthy. Low-impact exercise in a pain-free range will help promote a healthy joint. Go swimming, ride a bike, or even go for a walk. All of these activities are low impact and limit the amount of stress on your joints.
What causes an osteochondral lesion?
Osteochondral lesions can be caused by traumatic injury. Osteochondral lesions often go hand in hand with ligamentous injuries such as an ACL tear or meniscal tear. Lesions can also be a result of a dislocation of the patella or kneecap. Prolonged repetitive activity can also result in an osteochondral lesion. This repetitive activity can come from an occupation that requires frequent kneeling. Repetitive activity such as regular high-impact exercise can also lead to wear and tear of the joint and eventually result in an osteochondral lesion.
What are the common signs and symptoms of an osteochondral lesion?
Pain and swelling around the joint, pain with bending or straightening the knee, a cracking or popping from the knee, locking or catching when walking.
How will I know I have an osteochondral lesion?
A physical therapist will conduct an interview and evaluate your symptoms and medical history. Your therapist will be able to rule out other medical problems and will know when to refer you to your primary care physician or surgeon.
I have an osteochondral lesion. Now what? What are my options?
Conservative treatment. It includes physical therapy, NSAIDs or corticosteroid injections to decrease pain and inflammation, weight loss to decrease the stress on your knees. There's also the secondary treatment, which is surgery. If conservative treatment doesn't relieve your symptoms, it might be time to consider your surgical options. There are multiple types of surgeries for osteochondral lesions, but no surgical procedure is better than the others. Rather, the type of surgery selected is decided on a case-by-case basis.
What should I expect from physical therapy?
If you first decide to try physical therapy as conservative care, you should expect your physical therapist to address activity modification as well as stretching and strengthening of your hips and knees. If you decide to take the surgical route, the beginning of your post-operative physical therapy will first address your pain and swelling. Your physical therapist will help you manage your weight-bearing restrictions, which might include teaching you how to properly walk with crutches. During this time, you'll be working on regaining your motion and building your strength. Once the weight-bearing restrictions are lifted, your physical therapist will progress your exercise plan to include standing and more functional exercises. Your therapist will then challenge your balance to help you regain confidence and safety in completing your daily activities. Every surgery and therapy program is different, so be sure to explain to your therapist what you would like to get back to, whether it's work or play, so they can help you achieve your goals.